Welcome to North Olympic Library System's Aging Well program for May 2025. Today, we are going to hear about the services and volunteer opportunities available through Olympic Community Action Programs. Robin Pangborn and Holly Morgan are joining us today. Holly serves as Executive Director of OlyCAP, and Robin is the OlyCAP AmeriCorps Seniors Manager. We are so happy to have you both here with us. Thanks for joining us, and welcome to Aging Well.
Thank you.
Thank you very much.
Thank you, Karina. So I'm Holly Morgan, and I am the fairly new Executive Director with the Olympic Community Action Programs or Partnership, and that is affectionately known as OlyCAP in our community. I just started in this role in July of 2024. I came to the community after a long stint at the Easter Seals affiliate in Washington State, where I served as the Vice President of Programs and then to the COO level there. And prior to that, did some work in community behavioral health and other areas of kind of areas that are adjacent to community action, which is what OlyCAP is a community action agency. So I have a little presentation here to tell you a bit more about OlyCAP as an organization and the work that we do. And I'm sort of going to be at the higher level of what OlyCAP does, and then Robin is going to share with you some details about some of the volunteer opportunities and the program work that she's doing, which is super cool and fun, probably the fun part. So I'll try to get through my more boring part fast so you can get to the goods. Let's see. Just going to share my screen with you. All righty. Oop, I get all these little things everywhere. Let's see. Okay. Oops. Oh. All right, here we are. Can everyone see my screen okay? All right, beautiful. So as I said, my name is Holly Morgan. I am the fairly new Executive Director with OlyCAP, and I'm here with our RSVP Program Manager, Robin Pangborn. We are super grateful to be invited to come and talk to you guys and share with you some of the fun and cool work that we're doing at OlyCAP, just to give you some ideas of the scope of the work that we do. Looking back, OlyCAP is going to be 60 this year. We've been around since next May, 1 year from now, will be 60. So we started this journey in May of 1966. The community action movement was created out of Lyndon Johnson's War on Poverty as part of the Economic Opportunity Act back in 1964. Community action agencies were created across the country. And it was really the first time that communities at a community level got some significant funding from the federal government, augmented by state governments, that they could use to apply in ways that work for the community that they're working in. So, for example, if I wanted to start a volunteer program in Seattle, in King County, that program was going to look a lot different than a volunteer program that we start here in Jefferson and Clallam counties. So community action really allows the room for a community action agency to really to drill down and target the specific needs of the community that we're working in. So there is no one size fits all when it comes to programs, human service programs, and the types of work that we do. It's really targeted to the local market. And that is really the gift of community action, is that it allows us to work work within our own community to target our own community's needs. One of the things that have been kind of a flagship philosophy with community action is that we seek maximum feasible participation. And what that means to us is that we need people like you to be part of the work that we do to help inform our practice and where we need to go next. So it's super important for community action agencies in particular to get a lot of feedback from our community about what the needs are and what's important to you all and how you think we could address specific needs within our communities. So the community part of community action is really vital. So that's why opportunities like this are so exciting to us, because we get to come out and talk to people like you and really learn from you and with you about how we can best navigate problems that the community is facing. So, as I said, OlyCAP was established in 1966 as that was the original Community Action Council. They called it at the time Clallam Jefferson Community Action Council. Directly responding to the needs, unmet needs of poverty here in the Northern Olympic Peninsula region, so Clallam and Jefferson counties. Early efforts were focused on nutrition, so we've been a food bank since 1966. We have had Head Start programming since 1966. And we also helped assist with people who were seeking affordable housing and employment and other basic needs. So, OlyCAP today. We are today the Olympic Community Action Partnership, or OlyCAP. Our mission is to keep helping people build resilient communities. We bring solutions and opportunities to the table and engage the community in working through them. So it's pretty cool. As I said, we are in Jefferson and Clallam counties only. We have every year hundreds of staff and volunteers and partners that work across all of our programs, which is several different service lines, which we'll get into in just a moment. So these are some basic information about who we're serving. You guys know where you live, so I don't have to tell you that we are in a rural community and that we have some limited infrastructure and access to services. We've got a population here in Jefferson County, and I think this demographic is coming up. Yes, it is. But we have a population here in Jefferson County that is 40% over 65. That's the largest in the state in Jefferson County. So it's definitely a demographic in our area that needs attention and warrants quite a bit of attention and time and effort. 20% of our total population in each of the two counties lives with a disability, and 14% right now experience food insecurity in multiple forms. So as far as the aging population is concerned, as I said, 40% of Jefferson County's residents are over 65. 31% in Clallam County. So this is a great place to come to retire. And disability rates among seniors are a little higher than average. We just talked about 20% being the average in our area. Disability rates among seniors are at 30% in Jefferson and 34% in Clallam. So a pretty significant percentage of a significant percentage of our population are people who are living with disability in a variety of manifestations. Of the population of folks that are seniors living in our area, 55% in Jefferson and 31% in Clallam live in very rural areas, so outside of town, in some of the further reaching areas, which is beautiful locations. So some of the top challenges that our local residents face, and this is across the age group. So what I'm trying to get at here is what our greater community needs are. And then we're going to drill down a little bit into the aging population and the senior population and talk about what those needs are specifically. So we'll start with the top challenges. We just recently received our results for every 3 years, community action organizations need to do a community needs assessment. And what we do to create that report is survey a bunch of people. We have focus groups, just a variety of different ways that we get out into the community and talk to people, just like we're doing today, and have a real dialogue about what we need. So while we do this kind of formalized process every 3 years, and then publish it every 3 years, we are always working on gleaning from the community what the needs are and where the gaps in services are so that we can continuously improve. So you will be seeing periodically, advertisements for participating in a quick survey. And that's what that is all about. So if you're browsing Facebook and you see something pop up that says, hey, OlyCAP would like your opinion, that's why we really are interested in learning about what the community needs, and how we can better support the community. So right now, the one that we're just releasing, the community needs assessment that we just got in the can last week, tells us that behavioral and mental health services are deeply needed in our community. It's very challenging right now to find providers in those areas, organizations that can afford to pay a good wage, and it's an otherwise good job. It's just hard to find qualified professionals in that area, and then to bring those qualified professionals into a smaller rural area like ours is a little challenging as well. So we really have a shortage in professionals in the area that can assume some of these service gaps. We also have a real lack of affordable housing. Our area is on par, honestly, with the Seattle area as far as rents and the prices for homes. And also the market is very tight. I mentioned earlier that I came to this area last summer. And when we we started to look for a home, we were selling our home back on the other side over by the airport to buy a home here. When we went into the market, there were literally 5 homes on the market that fit our criteria, which wasn't, I mean, it's my husband and I. We didn't have any major special needs or anything, weird, that we weren't looking for a built-in pool or anything like that. It was just a regular house. And there were 5 on the market at the time. So it's a very tight market, and that drives up prices. So we also have a very high demand and limited availability for affordable childcare. So the young families that we do have in the area bump up against challenges around getting their children into a suitable childcare situation that they can afford. Right now, even DSHS, who the Department of, well, it's actually the Department of Young Children and Families, DCYF. Children, anyway, acronyms, there's so many acronyms in our field. They subsidize childcare for individuals who are living in poverty and working. They pay right now about $2,500 a month for infant care. So if you have a 3-month-old infant that you're taking to childcare, the state's payment is about $2,500. And if you're a private person paying privately, from your income, it's up potentially a little bit more than that. So that's huge. And access to affordable quality care for children, and also at this point elders in their family as well, can be really hard for people in our area. Transportation and isolation in the more rural areas of the counties is also a significant issue. We don't have, our local transit systems do not go super far out into the more rural areas. They're pretty good about inside the city limits. Port Townsend and Port Angeles and Sequim have some public transit available, but obviously that's not going way out to Brennan or even Quilcene. So there's definitely some barriers in that regard as well. And then, we have these underserved populations in part because of the demographics. So we have a high demographic of individuals who are over 65, like we talked about before. And what that can translate to is that organizations like OlyCAP really focus their service provision on people in that demographic, the largest demographic. And that can translate sometimes into less service opportunities for people in other demographics. So what we see in Jefferson County in particular is that we're underserving youth and young families because we have such a large proportion of individuals that are over 65. And that is kind of a vicious cycle, right? If we don't have services and we don't have things to bring these young families in, then they're not going to move here. So it's something that we're really looking at and working with the county and local governments to start bringing in younger families and to give people more opportunity once they get here so that they can really grow and thrive. So the needs of the 60+ population. Our community needs assessment indicated that we have a high rate of mobility challenges, disability, and chronic illnesses, as we talked about, 30% of your 40% number are people living with disabilities and other challenges. Food insecurity among seniors is becoming more urgent as a problem. Again, limited transportation and home care options. So getting to the doctor can be a challenge, particularly if your provider can't do certain testing procedures and things like that here locally. You have to go down to Silverdale or Paulsbo or even Seattle in some cases to get treatment or tests that you need. That can be a challenge. Social isolation is also a pretty big deal. Particularly folks who perhaps are more homebound and they're in a remote area. Maybe they don't have a neighbor that they can just, walk across the street and say hello to. And again, we just have a greater demand for age-friendly housing and in-home supports. And what OlyCAP is doing about that right now is looking at, we have 2 different low-income senior housing project developments in play right now. So we are seeking to build an addition to our South 7, our existing South 7 apartment complex, which is located in Hadlock. And we will be adding another building to that that we think will house an additional 20 family units or individuals. And then we also have some additional planning in mind for some, we have a property that's pretty old and really just needs to be torn down and rebuilt. So we're looking at that as well, and that would bring in potentially 70 units. It's a 4-acre parcel, so we're thinking we can put 2 buildings in there and create kind of a larger community of senior affordable housing. So that's coming, forecasting for you. So this is our basic roster of programs. We've got Head Start, Early Head Start, and ECAP, which is the state version of Head Start. So that's a preschool program targeting children from 0 to 6 in wraparound services. So we provide services for parents at the same time that we are offering early education opportunities to children. We are also involved deeply in housing. We are the lead housing provider in Jefferson County, and we provide emergency shelter, transitional housing, which means if you're homeless and you need a place to stay, but something more long-term than a night at an emergency homeless shelter, we'll put you into or we'll help you get into a transitional housing unit that is designed to give you a place to stabilize. And then we help you find permanent housing from there. And then permanent supportive housing is, as I was just talking about, the low income complexes that we're building come with support in the way of case management and housing vouchers and things like that to really help folks who might be struggling. And then along the lines of energy assistance, we have LIHEAP, which helps people pay their power bills. I know that in the past few years, energy bills have just really skyrocketed. I know ours has at home here. So we're seeing a lot of requests for services with LIHEAP. And it's honestly, it's more than we can handle sometimes. We're working this summer on sort of rebuilding that system so that when people need services, we can get to them sooner than we've been able to in the last couple of years. So we hope to be able to serve more people with that program starting this fall with a new kind of revitalized program. We also have a weatherization program for income eligible families who need who have a high energy output, who need help to kind of rehabilitate their homes to be more energy efficient. So sometimes that looks like adding insulation. Sometimes it looks like putting in a new HVAC system. This is a free service to qualified homes. As I said, there is some income eligibility criteria as well as home criteria. So the home has to fit a certain criteria before the state will approve us investing in that. So there is a process to that, but it is available. And then, of course, utility shutoff prevention is something that that we help people with all the time, year round. For youth services, they're primarily in our housing department, helping homeless youth get stabilized and into housing and into support services. We case manage and we offer vocational training to those youth. And then we have our nutrition program, which is our legacy food bank program. We have some mobile food markets that pop up. We also have some food outreach where we take boxes of food to folks who are in need right to their door. So let me just get to this next slide and I can talk about that. So this is the services that we tailor for seniors. And then Robin, you're next, okay? Just heads up. This is the services that we tailor for seniors. Senior nutrition. We have what is sort of loosely a Meals on Wheels program. And what that looks like is home delivery for prepared meals that they are prepared at the old alcohol plant in the Spirits Cafe. Bayside Housing owns and operates that cafe. And Bayside Housing, are providing vocational training opportunities to youth, the youth that we were talking about a couple slides ago. So they're getting vocational training in the area of culinary arts. So they're learning how to prepare the food. They're learning how to plan for large food prep experiences. They're learning how to order things. They're learning how to price things, all of that stuff in this program through Bayside. And then the meals that they're providing, the meals that they're preparing with all of this this work that they're putting into it, are the meals that we, OlyCAP, connect with seniors or individuals with disabilities who have a hard time getting out of the house. So we can come and bring them a box of frozen meals that they can enjoy throughout the week. That is a program that we are working on building our clientele for right now. So if you or someone you know needs a service like that, by all means, give us a call and let us know. This is not a service that is only for low-income individuals. It does provide a sliding scale so that people who have adequate income to pay for that can, and folks who do not will have a free service. And we also medically tailor these meals as well. So if you struggle with diabetes or high blood pressure or celiac disease or anything like that, we can accommodate those special dietary needs as well. So I would encourage you to give us a call, and you'll get some contact information at the end of our presentation here, and you can get yourself or someone you love enrolled, and that would be terrific. We also offer 4 days a week a senior meal program at our Tri-Area Community Center in Jefferson County. And what that looks like is 4 days a week. We have dinner that we prepare there on site. And people come in and sit down and have a community meal together. It's a social experience, and it's a nutritious meal, and it's free to folks who come in and enjoy. And then lastly, for specifically for our senior programming, we have an Encore Adult Center. And what that is a very small program. We only serve 8 to 12 individuals at a time. And it's a few days a week, 4 days a week, I think, a half day. And it's primarily for individuals that are experiencing some form of brain degeneration. And the program really helps to assist them with, memory activities. It engages them in arts and music and things like that. It gets fabulous outcomes. We see so many positive things coming out of this program, and we are very excited to let you all know that currently this is a Clallam County only program that we do up at the Lutheran Church in partnership with the Lutheran Church. But we are expanding that in 2025, in the next couple of months, into Jefferson County. So this is another opportunity. If you know someone, if you yourself would like to engage in a program like this, please call us. We're now accepting applications for our Jefferson County expansion. Again, small program, but that's part of why it's so successful, because people really get individualized services. It's really fun and cool. And the South 7 Senior Village currently has 15 units for low-income seniors. This is the one that I was telling you about a few minutes ago, that we're going to be looking at expansion. So we're in the process right now of getting all of the permits and all the things that we need lined up so that we can start that project. And we're super excited about it, as is the church, who is very committed to helping to alleviate the housing crisis locally. And then we've got the Retired Senior Volunteer Program, which is why we're here today, the star of the show. So I am going to turn this over to Ms. Robin Pangborn, who is an amazing provider in this area. So Robin, would you like to take over from here, and then just let me know when you need me to advance the slide?
Sounds great. Thank you, Holly. Thank you, Karina, for giving us this opportunity today. Good morning, everyone. For those that joined us late, I am the RSVP Program Manager for OlyCAP, and I am here to talk about one of OlyCAP's Senior Focus Program, the RSVP program, which RSVP, another acronym, Holly, is the Retired and Senior Volunteer Program. It's part of a national program. And it's federally funded by AmeriCorps Seniors. Did you want to advance the slide there for me, Holly? Thank you. And it is the federally funded, it is the only federally funded program or for AmeriCorps Seniors for a volunteer service. And a lot of people don't know that. They don't know that this is the only federally funded volunteer service program. And of course, it's locally sponsored by OlyCAP. And we serve Clallam and Jefferson counties. And what the goal is to match individuals to volunteer service with our nonprofit and civic organizations. You can go ahead and advance the slide for me. I thought it was another. Oh, there we go. So who is eligible? So adults 55 and better, and I said yes, I said better, and that's it. There's nothing else necessary, okay? There's no limitations, and we're going to accommodate you the best way we possibly can. Mobility challenges or any other disabilities, don't let it stop you from reaching out. Also, another great thing about this program is it offers flexible hours. You can choose how many hours and you can schedule when you're available, just whatever is going to work for you. Some people put in a few hours, some people put in 100 hours a month. So what is the program designed for? This program is designed to reduce social isolation, help seniors stay active and involved in your communities, in work that has local impact. It supports volunteer-based local food banks, congregate meal services, home-delivered meals like Holly was talking about earlier, our nutrition and food support programs, volunteer hospice, and in Jefferson County, senior transportation to medical appointments, even transportation to the ferry for people to get to those appointments that are happening in Seattle, and many other volunteer opportunities. You can go ahead and advance the slide for me, please. So what do we know about RSVP volunteer benefits? So we know that they have done evidence-based studies at AmeriCorps that show that 85% of volunteers report enhanced health and overall improvement and overall well-being in the first year of service. I can tell you that I currently have 250 plus active volunteers enrolled in the RSVP program between Clallam County and Jefferson County. And I do an annual survey which tracks the performance measures of the volunteer services that are being provided by my volunteers. And it has always been my pleasure to hear them say, I mean, there's great testimony. They'll say they get more from volunteering than they give. That it's, and for me, that's rewarding to know that they, feel like they're helping their community, they're helping their neighbors, they're making local impact, and basically they're helping someone have a better day by providing volunteer service and meeting essential needs in our communities. Go ahead. And so there are benefits to being an RSVP volunteer. OlyCAP provides volunteer insurance. That is one of the qualifications to be able to manage an RSVP program is the entity, agency, organization needs to be able to provide personal injury volunteer insurance, liability insurance, and excess auto liability insurance coverage while in the performance of your volunteer service. Another great benefit is that you can qualify for service milestones, including years of service awards based on how many hours you serve a month and through a 12-month cycle. And one thing I'm particularly proud of is that we are a certified organization that we are allowed to present the prestigious Presidential Lifetime Service Awards. It's a beautiful certificate. It comes with medallions, and we usually make a big fanfare out of it and award people certificates that are gilded in gold. So we love that. And then we also have recognition and appreciation events. Last year in June, I took a whole group of volunteers to the Lefties baseball game in Port Angeles. And let me tell you, they had a ball. We even had a volunteer who threw out the first pitch. And we provided food and entertainment, and it was just a great time for people to congregate together, enjoy each other's company, have a social outing. And it was all sponsored by the RSVP program. And then also, it build meaningful friendships and support your well-being. Many volunteers report, as I said before, health and reduced loneliness. And that, again, was one of the things in our community needs assessment was drawn out that this is in fact an issue for our area. So we're glad to have a program to help us address some of these gaps in service, and also to help our beneficiaries to live longer, be happier, and enjoy what they're doing with their time. And then exploring a variety of ways to give back locally with flexible opportunities that match your interests. Again, we want to know what's your passion, what skills you might have, if you have experience in something. We are always looking for grant writers to people that are able to stock food at the food banks and everything in between. So I would love to hear from any of you on here, or please let your neighbors and friends and family know. If you're 55 or better, reach out through our contact information, and I'd love to connect you with one of our local services. And thank you so much, Holly, for giving me the chance to present this today.
Yeah, absolutely. Do you want to speak to are these your slides?
Yes.
Okay.
So this final one is just a wonderful illustration of an image of a volunteer serving at a local food bank. And he was giving his testimony for us on how much he enjoys being an RSVP volunteer. And I think you can tell by the expression in his face that he's very content and satisfied with providing volunteer service. And then the other image is we have mobile food banks located in Port Townsend, also moves to Port Hadlock, and then here in Sequim more recently. And this is volunteers that are serving at these mobile food banks, providing food and nutrition support through OlyCAP programs. And then I just put a few logos on there. You can see ECHO, Vet Connect for our veterans and referral service, and Jefferson County Food Bank Association. We are partners, great partners with them. So we are developing relationships and have great relationships with a lot of partners. And if you know somebody that's looking to partner with OlyCAP, we'd love to hear from you. And that's about all I have. I look forward to hearing from you, text, email, or a phone call. Anything is welcome. Thank you so much again.
Thank you, Robin. Good job. Appreciate that. So I'm just going to talk a little bit. We just have a few more slides left. I just want to talk a little bit about the community impact of OlyCAP. We serve 8,000 individuals every year across both counties. We have over 100 folks over 65 receiving monthly food deliveries and attending our congregate meals that I described for you out at the Tri-Area Community Center. We have youth being trained in job skills while promoting meal prep, while supporting meal prep program, excuse me. And we've got just tons of testimonials and success stories that show transformation at every age. When we're able to help our families that are Head Start families with their, they have small children at attending classes with our preschool program, and while they're attending parenting classes and things like that. So just lots of really great things going on. This is a special guy. Robin, would you like to talk about Sydney? You're muted. There you go.
Yes, Sydney is a longtime volunteer in our RSVP program. He serves in the Head Start program. As you can see, his testimonial is he's 75 years old. He's very dedicated to the RSVP program, and he's been with the program since 2018, donating over 1,200 hours to our program. What he loves to do is read to the 3 to 5-year-olds, serves them breakfast, offers them comfort, and very supporting to them. And when you ask Sydney, because I kind of interviewed him for this, when you ask him, Sydney, what do you get out of your volunteerism? And he says, oh, I get more out of my time with the children than I give. And that was just like that. It was all he said. So I'm like, okay. And so he also volunteers with OlyCAP Senior Nutrition Services. He's a very busy individual. He does not want to sit home and let grass grow under his feet. But he is just a wonderful person, and we really enjoy having him. I'm hoping to have him mentor our newer volunteers that join the program to kind of show them the ropes. But we thank Sydney for his kindness and his commitment and how he inspires us all. So we say, thank you, Sydney.
Thank you, Sydney. Thank you, Robin. Sydney, we feature Sydney quite a bit, and it's always just so nice to talk about Sydney. We should have him join us on some of these sometime, Robin. So I know the burning question for you is, how do I get into this OlyCAP action? So we have 5 locations around the area where you can access services, including Port Angeles and Port Townsend primarily. And we have many multiple service sites in addition to that in Sequim, Forks, and other areas. Any of our staff, anyone that you connect with, there's no wrong door. Anyone you connect with can help determine your eligibility and help you get to the right people. So you don't need to worry about getting the runaround or there being kind of a hassle. And services that we provide to our neighbors and community members are always confidential and tailored to your needs. Like I was talking about before, there is no one size fits all service. So we try to go where you are. If you need something, let us know and we will see what we can do. So how can you support the mission? There's many ways. You could always donate. We do have the Open Door Fund, which is funding that goes directly to our neighbors. OlyCAP does not keep any part of that. It comes in as donations from community members, and it goes back out to our neighbors in need to help them with things like if their car breaks down and they can't get to work, we'll help them with a car repair. If they have an emergency shut-off notice on their water bill, we'll help them pay to get caught up. That kind of thing is what the Open Door Fund does. And then, of course, we have a general fund that helps support our programs as well, such as our emergency homeless shelter. You can become a community ambassador. So you can go out and it's as easy as, when you're at church this weekend, just talk to your friends about this interesting presentation that you learned all about, these things that OlyCAP does that maybe you didn't know about before. So please share with your friends and your neighbors. Let them know that they can get help if they need it. They can provide help if they're inclined, if we're fortunate enough to be able to help other people. They are absolutely welcome to join our team as a volunteer. And every act of kindness that you put out there, even, just between you and your neighbors, drop them off some green beans that you picked from your garden that you can't use. Every act of kindness strengthens our safety net here locally. So, it might not feel like it's any big deal, but it is, and your neighbors really feel that. So thank you for everything that you do along those lines. And I know you're out there doing stuff like that. So thank you. Okay, and so we can answer any questions if you have them. Robin and I are both here to respond to any questions. And here is some contact information if you would like to reach out to us to talk about service provision or volunteer opportunities or to make a donation. You are very welcome to tap us at any of these in any of these ways. Now I can open the floor to any questions if you have them. Amy.
Hi, thank you. That was a very informative. I'm not sure if it was a presentation by OlyCAP or not, but I saw a dementia awareness presentation sometime in the last few months. And I was curious if that's an area if that was from OlyCAP or not, or somewhere else.
I am not sure. I don't know of a dementia presentation that we have done recently.
Was that the
Although,
OlyCAP Aging Agency, Karina?
do you mean the
Olympic
O3A?
I
area
was
agency
just
that did that
I was just
presentation?
thinking that that might have been
In November?
Olympic
Yeah.
Area Agency on
Yeah.
Aging. They did a
Yeah.
presentation through the library for Aging Well, talking about
Okay.
yes.
And they thank you for clearing that up. And they actually help support our encore arts program for folks with brain degeneration. They help support that very program, Amy.
Thank you. I'm sometimes not clear which organization is offering which services. So
Yeah.
thank you.
Yeah, absolutely. Thank you for the question. Hi, Vicki.
You're federally funded, and all the stuff I hear on the news lately, are you worried about that funding being cut? I mean, that would be awful.
I think we could
Yes.
both answer that.
Yes. So there are many changing priorities on the federal and the state level. And the state, it's a little bit more of a money situation. The governor was looking at a pretty significant budget shortfall this year. So there are some cuts being made at the state level, more driven by a lack of funding. And anticipating an increased lack of funding because of the change in the federal priorities. So what happens now is that the federal government sends the states money via block grants, which I know you guys have heard of that. And then the state disseminates this money. It's called a pass-through. So the state gets the money from the feds and then they give it to organizations like ours. But the state is anticipating less coming from the federal government, and the federal government's budget priorities have changed with the new administration, and we're not sure exactly what that's going to look like yet until they finish with the federal budget development. Right now, we know that the initial budget that was submitted to Congress wrote out completely our energy assistance program and RSVP, Robin?
Yes, and RSVP was taken out in the 11th hour.
Yeah,
Oh,
so we don't know if it will stick. It's possible that that they won't get that passed. And we were very fearful for our Head Start program, but the Head Start advocates really won the day and were able to seek or receive continuation funding. And we continue to advocate. Another mission of community action is to advocate for our communities and making sure that resources are coming into our communities. And we have done that all year this year. Tanis and I in particular have been to DC to meet with representatives there. We've been to Olympia, all of that, just to make sure that people know that we're a small town, we're a rural area, but darn it, we need to be able to provide services to the people who live here. So thank you for asking that. It's a really critical question right now.
And I did want to
Mhm.
also clarify for the RSVP program. So the AmeriCorps Seniors program requires a match, and the state funding was covering my match. So that's what I have lost, is a funding for my match, and that will be starting July 1st. So I will be actively looking for ways to replace that source of funding in order to support that requirement that the federal funding requires.
Right, right. Every dollar that we get in federal funding comes with a requirement to what they call match the funding with other funding sources. So what they're looking for
Oh.
is for us to diversify where we're getting our revenue. So they don't want us to put all of our eggs in one basket, which is pretty smart, actually. We want to be able to continue. And if we are only counting on one source and that source goes away, then we have nothing. So that's a really important point, Robin. Thank you.
I compliment you on your politically correct answer. Yes. I would have been vicious.
I save that for dinner conversation with my husband.
Yeah, I understand. You really can't, be vicious.
Yeah. Oh, Jennifer.
Hi, yeah, I have a question with the housing. Do you all work at all with like Habitat for Humanity or Serenity House? I know they're doing some stuff with housing. Just wondering if there's a collaboration between everyone.
Yeah, so yes, Serenity House has so there's a lot of like jargon, so I'm going to try not to be too jargony for you, but Serenity House is what's referred to as a lead agency for housing in Clallam County, and OlyCAP is the lead agency in housing in Jefferson County. So we're doing the same work in our respective areas, and then we also work together on continuum of care types of situations. So if you come to OlyCAP for services, we work with Serenity House in the area of housing in particular to have, so if you want to move from Jefferson to Clallam, you can have your services continued in the next county over. So we do work together in that regard. With organizations like Habitat, we kind of work around them. So we're working in the same space. We have members of our board, our employees at Habitat. We also work with Bayside Housing quite a bit, probably more than any other provider. We're also working with Owl 360, which is a youth provider for youth with unstable housing. And we also work with Dove House to help support families that have been victims of domestic violence getting into a safe and stable home environment. So yeah, the P is for partnership, and we take that really seriously, and we try to partner whenever we can. Working together makes our service provision much stronger than all of us kind of doing our own thing. So yeah, I'm a real proponent for getting out there and getting partners. We don't have competitors, we have partners, right, ladies? For sure.
100%.
Thank you. Yeah, thank you very much.
Yeah, thank you for asking.
Are there any other questions for Holly or Robin? All right, I'm going to reshare my screen. And we will wrap things up. Thanks to both of you for all of this information. I have had a very general knowledge of all the wonderful support OlyCAP provides to the area, but wow, to see it all spelled out, just wonderful to know that that is there helping the folks who need it. So thanks to both of you, and thanks to everyone at OlyCAP.
Thank you.
Our
Thank you,
pleasure.
everybody, for hearing us out. We appreciate you.
Okay, so our next Aging Well program will be taking place here on Zoom in September at 11 a.m. on Tuesday, September 16th. Keep an eye on our website. Check back maybe in August to find out the details on what that program will entail. That's still being worked out at this point in time. So check back with us later this summer. And again, thanks to Holly and to Robin. Thanks to all of you for being here and for supporting Aging Well. And I hope you all have a beautiful day, and we will see you next time.
Thanks, everyone.
Thank you so much, everyone. Have a great weekend.
You too. Bye-bye.
Bye.